communities in Ottawa. This includes increasing funding for Indigenous health programs and ensuring that Indigenous voices are central to the decision-making process, and to strengthening partnerships with Indigenous organizations to collaboratively address health disparities. This involves regular consultations with Indigenous leaders, investing in community-led health initiatives, and fostering an environment of mutual respect and understanding. And I ask you, my colleagues, to reflect on your continued action to support Indigenous health equity and self-determination of all Indigenous people. Can I get the roll call, please, Madam Board Secretary?
Member Bauer?
Present.
Member Carr?
Here.
Member Chung? Member Dudas?
Here.
Member Gower?
Here.
Member King?
Here.
Member Bradley?
Here.
Member Ejiofor? See her online. Vice Chair Giovanni?
Present.
Chair Kitts?
Here.
We have quorum, Madam Chair.
Thank you so much. We don't have any regrets this evening. Are there any declarations of interest?
Yeah. Look, I was trying to work on my mic. Ejiofor is here.
Okay, thank you. We'll note that. No declarations of interest, though? Okay, seeing none. Confirmation of minutes or the meeting minutes of February 10th, 2025 confirmed. Thank you. I'll note we have 2 communications items that have been received and are held on file with the Board of Health Secretary. Motion to introduce reports. Member Gower, please.
Be it resolved that the Chair of the Board of Health verbal report, the Medical Officer of Health verbal report, and the reports titled Indigenous Rights, Health and Reconciliation, Update on Ottawa's Overdose Prevention and Response Strategy, 2024 Operating and Capital Year-End Results, Board of Health for the City of Ottawa Health Unit Status Report, Delegation of Authority, Contracts Awarded for the period of July 1st to December 31st, 2024, and attendance at the Association of Local Public Health Agencies 2025 Conference and AGM be received and considered.
Thank you. Is this carried? Wonderful. So we'll move on to the agenda. Item 8.1, Chair of the Board of Health verbal report will be held for my verbal. 8.2, Medical Officer of Health verbal report will also be held. Item 8.3, Indigenous Rights, Health and Reconciliation. Is this item carried? Thank you. Item 8.4, update on Ottawa's overdose prevention and response strategy. We will hold for a presentation and delegations. Item 8.5, 2024 Operating and Capital Year-End Results, Board of Health for the City of Ottawa Health Unit Status Report. Is this carried? Great. Item 8.6, Delegation of Authority, Contracts Awarded for the period of July 1st to December 31st, 2024. Is this carried? Great. And item 8.7, attendance at the Association of Local Public Health Agencies 2025 Conference and AGM. Is this item carried? Wonderful. So we will go back to item 8.1, which is my verbal report. So good evening, everyone. Kwei, thank you all for being here again this evening. On May 5th, 2025, we will recognize the National Day of Awareness for Missing and Murdered Indigenous Women, Girls, and 2S LGBTQIA+ people. This day, also known as Red Dress Day, serves as a powerful reminder of the human rights emergency affecting Indigenous communities across North America. Plus tard ce soir, le conseil d'administration recevra une mise à jour complète sur les droits à la santé et à la réconciliation des Autochtones. Ce rapport souligne le travail important accompli à SPO pour devenir une organisation respectueuse de la culture et respectueuse de tout. Through the continued efforts of the Indigenous Cultural Safety Organizational Assessment and the newly formed Advisory Circle, OPH is committed to fostering an environment that respects and supports Indigenous peoples. As we mark this Red Dress Day, which recognizes the ongoing crisis and the need for collective action, I encourage all board members and members of the public to support Indigenous communities by participating in events, wearing red to raise awareness, and educating themselves about the issues faced by Indigenous women, girls, and 2S LGBTQIA+ people, and the inquiry into murdered and missing Indigenous women and girls calls for justice. Together, we can make meaningful strides towards reconciliation and ensure a healthier, more equitable future for all. As we approach National Mental Health Awareness Week, which will be celebrated from May 10th to May 16th, 2025, I want to reflect on the significance of mental health in our community. Le thème de cette année est communauté, soulignant le rôle essentiel des communautés solitaires dans notre santé mentale et notre bien-être. Des liens forts et un sentiment d'appartenance peuvent apporter sécurité, soutien dans les moments difficiles et sains à la vie. Positive mental health is essential for a person's well-being. Each year, 1 in 5 Canadians experience a mental illness or mental health issue, and for many, accessing the right mental health care has been challenging. OPH works with care providers in the community and has many resources available to promote good mental health for our residents. We continue to work with OPH staff on our mandate to strengthen community mental health services and support related policies and legislation at the provincial and federal levels of government. Pour développer et maintenir une bonne santé mentale, nous devons évoluer dans un environnement qui favorise la compassion, que ce soit au travail, à l'école ou dans notre quotidien. Des liens sociaux forts contribuent à renforcer notre résilience, à améliorer notre santé physique et mentale et à nous aider à gérer les facteurs de stress de la vie. J'encourage les membres de la communauté à nous contacter et à partager leurs expériences et leurs efforts pour promouvoir leur santé mentale avec une personne de confiance. I am thrilled to share that the Registered Nurses Association of Ontario recently recognized Ottawa Public Health for our outstanding contributions to advancing youth mental health. OPH received a recognition award for mental health excellence, and our team lead for youth mental health, Andrea Stelmach, was featured in the Registered Nurses Association of Ontario Registered Nurse Journal. This award highlights our work with the Provincial Youth Wellness Champions Program and the creation of OPH's peer-to-peer program, Youth Connections Ottawa, which engages youth to enhance their mental health and well-being. Congratulations to the entire mental health team for this important recognition. We will be celebrating this achievement during the Nursing Week celebrations, and I encourage all board members to attend. On April 4th, I had the privilege to deliver opening remarks at the Future of Health and Wellness Series panel discussion that examined the impacts of extreme heat and climate change on the health of people in Ottawa. The event, organized in collaboration with Algonquin College, was moderated by Claude Brûlé, President and Chief Executive Officer of Algonquin College. The panelists included Dr. Glenn Kenny, Professor of Physiology at the University of Ottawa, Carolyn Metz, Managing Director of Climate Resilience and Health at the Intact Center on Climate Adaptation at the University of Waterloo, and Stéphane Guijard, Chief Executive Officer of Ottawa Community Housing Corporation, who shared effective cooling strategies to protect populations disproportionately affected by extreme heat, including older adults and children. Ottawa is facing significant extreme heat and climate change challenges, which can impact health in many ways. Rising temperatures can exacerbate health conditions and increase the risk of heat-related illnesses like heat exhaustion and heat stroke. Extreme heat events strain healthcare systems, leading to increased emergency department visits and longer stays in hospital, and can be deadly for many people. Addressing the health impacts of climate change requires collective efforts. No single entity can tackle this challenge alone. By working together, we can develop innovative solutions, share resources, and amplify our impact. I'm grateful for the ideas that flowed during and after these panel discussions to keep us moving forward to protect the future of Ottawa's health and wellness. I'm also pleased to announce that OPH has successfully secured funding from Health Canada's Climate Change and Health Capacity Building Program, known as Health Adapt. This funding application was a collaborative effort between OPH's Healthy Environments team and the city's Climate Adaptation branch. $630,000 over the next 3 years will be used to advance 3 key projects addressing gaps identified through the climate change and health vulnerability assessments. The first project seeks to improve climate change messaging, specifically in reaching equity-denied groups in an appropriate and effective way. The second project, in collaboration with Infrastructure and Water Services, will apply an equity framework to select locations across the city for installing 6 fire hydrant water fountains with misting features over 3 years, with locations to rotate throughout the spring and summer months. The third project, in partnership with the Community and Social Services Department, will explore options for installing, operating, and maintaining permanent mechanical cooling in various types of existing social housing buildings. The project will provide valuable information to social housing providers for future asset management planning. We would like to acknowledge and thank Health Canada for their financial contribution to these important projects. Before I conclude my verbal report this evening, I would like to acknowledge Canada's National Day of Mourning on April 28th, a day dedicated to honoring workers who have tragically lost their lives, suffered injuries, or fallen ill due to their work. On behalf of the Ottawa Board of Health, I extend our deepest condolences to those affected and their families. In remembrance of these individuals, I would like to highlight the upcoming Safety and Health Week taking place from May 5th to 10th. Cette semaine constitue un rappel crucial pour les employeurs, les employés, les partenaires et le public de donner la priorité à la prévention des blessures et des maladies, non seulement sur le lieu de travail, mais aussi à la maison et au sein de notre communauté. Let us all commit to fostering a culture of safety and health, ensuring that every environment is a safe one. This concludes my verbal report. I would be happy to take questions. Seeing none, is this carried? Great, thank you. Or received. Is it received? Great. Item 8.2, Medical Officer of Health Verbal Report. Over to you, Dr. Arneson.
Good afternoon.
Thanks. Good evening. Kwe, Unusakut, Tanshi, Ani, bonjour. I'm offering greetings in Anishinaabe, Inuktitut, Michif, the language of the Métis Nation, and Ojibwe, also known as Anishinaabe-Moan, as a sign of respect and appreciation of Aboriginal languages in Canada, as tonight the Board of Health will table a report on Indigenous health rights and reconciliation. This evening's updates on initiatives underway will include monitoring of the measles situation in Ontario and routine immunizations, followed by a staffing announcement for Ottawa Public Health and recognition of National Nursing Week. Measles is a highly contagious disease, and although there are no reported cases in Ottawa residents, we are seeing reports in other jurisdictions in Ontario, including our neighbouring public health unit, Southeastern Ontario, which includes Kingston and Belleville. To date, there have been over 800 positive cases reported in Ontario. The majority of these cases have been in unvaccinated children. OPH continues to monitor all reportable infectious diseases, including measles, to ensure our readiness to respond by working closely with local healthcare providers and local hospitals. The most important message we can share is that immunization remains the most effective way to prevent measles, providing close to 100% protection in children with 2 doses. In my last verbal report, I shared the important work we've been doing to help children and youth stay up to date on routine immunizations, including measles. We've continued our annual surveillance process, reviewing the immunization records of children attending school to ensure they comply with legislative requirements. This includes reviewing the records of 7 and 17-year-olds to ensure their vaccination records for the 9 vaccine-preventable diseases required to attend school are up to date with public health. Through our 2024-2025 school year surveillance process, we have been effective at reducing the percent of 7 and 17-year-olds whose records show they are missing 1 or more immunizations from 70% to 24% in 7-year-olds and 59% to 34% in 17-year-olds. We expect these numbers to improve further as our surveillance process continues through to the end of the school year. OPH, along with community partners, including Kids Come First, continue to support children and youth who are not able to access routine child immunizations through a primary care provider. In 2024, OPH administered over 26,000 routine childhood immunizations, including 3,900 measles-containing vaccines. In the first quarter of 2025 alone, OPH has administered 1,500 measles-containing vaccines to children and youth. Historically, these vaccines were all delivered entirely through primary care. Although we have more work to do to continue to promote immunization uptake, our efforts are making a difference. I want to thank our team at OPH, community partners, school boards, and especially parents and guardians for helping increase immunization rates and protect against diseases preventable through immunization in our community. Même s'il nous reste encore du travail à faire pour continuer à promouvoir la vaccination, nos efforts portent leurs fruits. Je tiens à remercier notre équipe de santé publique Ottawa, nos partenaires communautaires, les conseils scolaires et surtout les parents et tuteurs qui contribuent à accroître les taux de vaccination et à protéger notre communauté contre les maladies évitables par la vaccination. I'm pleased to announce the appointment of Dr. Laura Burns as the Interim Deputy Medical Officer of Health for the City of Ottawa. Dr. Burns will serve in this position until the Medical Officer of Health role is filled later in 2025. Dr. Burns brings a wealth of experience and expertise to this role in leading the Public Health Medicine Unit and as a member of our senior leadership team. She's currently an Associate Medical Officer of Health at Ottawa Public Health and an Adjunct Professor at the University of Ottawa's Faculty of Medicine. Dr. Burns holds a Bachelor of Science, a Doctor of Medicine, and is certified as a family doctor by the College of Family Physicians of Canada and as a public health and preventive medicine specialist with the Royal College of Physicians and Surgeons of Canada. Dr. Burns has been a dedicated member of our public health team, contributing significantly to our efforts in infectious diseases and health promotion. Her leadership and commitment to public health will continue to be invaluable as we navigate the challenges and opportunities ahead. La Dr. Burns est une membre dévouée de notre équipe de santé publique, contribuant significativement à nos efforts en matière de maladies infectieuses et de promotion de la santé. Son leadership et son engagement en matière de santé publique resteront précieux pour relever les défis et saisir les opportunités qui nous attendent. Please join me in welcoming Dr. Laura Burns to her new role. We look forward to her continued contributions to the health and well-being of our community. In closing this evening, I would like to highlight the upcoming National Nursing Week, which will be celebrated from May 12th to May 18th, 2025. This year's theme, The Power of Nurses to Transform Health, recognizes the invaluable contribution of nurses and the real-life challenges they face every day. As the interim MOH, I am proud to support, collaborate, and recognize all the nurses working at OPH. I'm always impressed with their commitment to improve the health and well-being of Ottawa residents. Throughout the week, various events and activities will take place to celebrate and acknowledge the hard work of nurses. I encourage everyone to participate in these celebrations and express gratitude to OPH nurses who have made a significant impact in our lives. Tout au long de la semaine, divers événements et activités auront lieu pour célébrer et souligner le travail acharné des infirmières et infirmiers. J'encourage tout le monde à participer à ces célébrations et à exprimer sa gratitude envers les infirmières et infirmiers de SPO qui ont eu un impact significatif sur nos vies. National Nursing Week is a time to honor the dedication, resilience, and compassion of nurses who play a critical role in our health system. From providing essential care to advocating for patients' well-being, nurses are at the forefront of public health services, ensuring that our community remains healthy and safe. This concludes my verbal report. I would be happy to answer any questions.
Great. Thank you, Dr. Arnson. I'm not seeing any questions for you. So is this item received? Great. Thanks, everyone. So we'll move on to item 8.4, update on Ottawa's overdose prevention and response strategy. We do have a presentation from staff and then several delegations. So I'll invite staff to come up to the microphone here. Whenever you're ready.
Thank you very much. Hello, good afternoon, everybody. My name is Benjamin Lakin. I'm the manager of our Community Health and Wellness branch at Ottawa Public Health. With me today is Kira Mandrick, Program Manager of Sexual Health and Harm Reduction Services, and Christina Smith, Nursing Project Officer of our Community Health and Wellness branch. Today, we will be providing an update on Ottawa's overdose prevention and response strategy. In this presentation, we'll be covering the recommendations put forward in the report and the key priorities, both of which represent the work of many partners across the region, from health and social services, hospital, emergency services, and more. I will now pass it over to my colleague Kira to get us started. Thank you.
Thanks, Ben. We would like to begin our presentation this evening by acknowledging the profound and significant hardship and loss that people continue to experience in the face of the ongoing overdose crisis. Grief, mourning, and distress are felt by many, including families, friends, healthcare and social service providers, and many more affected. To combat this crisis, it is essential to confront the underlying causes, primarily rooted in discrimination and insufficient access to essential needs and human rights, like proper housing, safety, and support. Individuals using drugs often face stigma and various interconnected forms of discrimination, such as racism, sexism, and colonialism. In November 2023, the Board of Health received a report on Ottawa's updated overdose prevention and response strategy. The strategy was established in collaboration with the Overdose Prevention and Response Task Force, which is comprised of individuals and organizations across many sectors, including people with lived and living expertise, community health, hospitals, pharmacies, the coroner's office, mental health, addictions, and substance use health providers, the Community and Social Services Department, and our emergency service partners at the City of Ottawa. While traditionally many municipal drug strategies include a 4-pillar model, the Ottawa strategy is a comprehensive 7-pillar approach to address the multifaceted challenges posed by the toxic drug crisis, as well as the need to promote substance use health, improve overall well-being, and ensure access to safe, affordable, and supportive housing. 2024 saw the expansion of existing and many new initiatives advancing work across all 7 pillars of the strategy. The actions under these pillars represent the collective work of all of these incredible partners. So you'll see on this slide here represents just one example of interventions implemented by our many strategy partners, or OPH directly, under each of the 7 pillars. The key activities document accompanying this board report provides a summary of many of the important initiatives actioned in 2024. Advancing prevention work across the lifespan, OPH launched a 9-week cognitive behavioral therapy group for expecting or new parents to support positive mental health. Scaling up efforts to address stigma, partners including OPH and Pinecrest Community Health Center made the Stigma How You Can Impact Change a mandatory training for all staff. Expanding access to life-saving harm reduction services, Somerset West Community Health Center delivered evening outreach providing peer support and overdose response to isolated people who use drugs. Further coordinating access to treatment services, the Ottawa Hospital became an early site for Ontario Health's new Substance Use Disorder Integrated Care Pathway Initiative. The Ottawa Police Service rolled out a community outreach response and engagement strategy to improve community safety and well-being. And lastly, OPH and task force partners have worked on enhanced data and surveillance tools and introduced a new public drug alert system available for sign-up at stopoverdoseottawa.ca. As part of recommendation 1, we also outlined key priorities for 2025, which Ben will speak to later in the presentation. As demonstrated in the report, there continues to be an urgent need for additional supports to more effectively address this complex crisis and its intersection with mental health and vital social determinants of health. The closure of the consumption and treatment service at Somerset West leaves a critical gap in life-saving services and connections to care for those who rely on them. Consultations with community members and service providers have identified pressing needs and interventions to support people experiencing harms from substance use, while also addressing the broader impact on communities and neighborhoods, including concerns voiced by residents that this closure will lead to increased challenges in neighboring communities. There continues to be gaps in service across the spectrum of substance use needed to meet people where they're at. This means ensuring that healthcare and other essential services are not only geographically accessible across the city, but also responsive to the diverse needs of individuals. As we've highlighted, promising advancements have been made over the last year, including successful provincial and federal funding proposals put forward for 2 collaborative initiatives focused on improving outreach efforts and connections to safer spaces, as well as the implementation of the new homelessness, addictions, and recovery treatment or HART hubs. However, many of these novel interventions are time limited in their funding. A repeated concern that we've heard from our partners is that there's a lack of sufficient and sustainable funding to maintain the services needed. This includes a need to provide competitive wages and adequate training and supports to an already overburdened workforce. Service providers, people with lived and living expertise, community members, and associations have all identified innovative solutions to address this crisis and its accompanying harms. However, these solutions are at risk without sufficient and stable funding. Recommendation 2A highlights that a sustainable, multi-sectoral, and multi-governmental response is needed to implement long-term, well-supported solutions across all 7 pillars of the overdose strategy. Central to this is the urgent need for safe, affordable, and supportive housing. I will now pass the presentation over to Christina to speak to the next recommendation.
Thank you, Kira. So one of OPH's foundational tasks is monitoring and evaluating health status and impacts to help inform policymakers and community and health partners in their work. You can see this type of work with our mental health addictions and substance use health community dashboard found at ottawapublichealth.ca/wellness dashboard, and with our overdose overview reporting tool on our stopoverdoseottawa.ca webpage. The dashboard provides residents, policymakers, and community and health partners with local and in-depth community-level information on the mental health and wellness of people in Ottawa. And our overdose reporting tool provides more local and timely information on the impacts of the toxic drug supply in the city. OPH has heard from key partners across different sectors that effective data collection and dissemination is crucial for driving effective decisions and actions. As outlined in the recent Auditor General's report on Ontario's opioid strategy, it was poor data tracking that made it challenging to accurately plan, monitor, and improve addiction services. Therefore, in recommendation 2B, OPH suggests that the dashboard and the overdose tool be used as relevant models for data collection and dissemination. To build on that point, I would like to provide examples of the importance of available data on this slide, and will then discuss the impacts that the data has. Here you can see a snapshot of the data used to drive the interventions of OPH and of our many partners that work in this area to prevent harms and promote overall well-being. This slide provides just a couple of important pieces of data that influences the work we do, and they are available in the dashboard. Due to the increasingly toxic drug supply, we have seen a significant rise in deaths in 2020. In addition to the toxicity of the drug supply, we are seeing an increase in self-reported opioid use by students, with an increase from 10% in 2021 to 20% in 2023. Also concerning, we are seeing students in grades 7 and 8 reporting the same level of non-medical opioid use as students in grades 9 to 12. Of note, the most current data on opioid overdose deaths is in line with what is being seen across North America, with a decrease from the peak in 2023. While this is a reason for hope, the number of opioid overdose deaths in 2024 continues to be higher than pre-pandemic levels when we were already experiencing a crisis. This decrease provides more evidence for why there needs to be sufficient and sustainable funding to ensure that existing efforts to address the ongoing crisis can be maintained and new initiatives can begin to support continued progress. It is through this data that the Mental Health and Addictions and Substance Use Health Community Dashboard and the Overdose Overview tool are currently being used by OPH and by partners to drive actions. These tools are being used to identify gaps, plan for services, including providing data that inform where the new anchor pilot program would be, influencing the health and social care systems, including providing data and evidence to bolster the applications for both Ottawa area heart hubs, applying for various funding opportunities, such as the successful Emergency Treatment Fund from Health Canada, and evaluating impact. The dashboard was built in close partnership with community organizations who help shape what data should be included and how it's shared. Because of this collaboration, the dashboard is not just a tool, it's a reflection of real community needs and voices. These tools don't just show numbers, they tell a story. The data is presented in clear visuals, and it breaks things down by important social factors like gender, age, income, and more, so that we can see health inequalities and work towards greater equity, which demonstrates why these tools are useful models for others to follow. I will now pass the presentation over to Ben.
Thanks, Christina. Moving to recommendation 2C, we have a recommendation here that comes directly from an Indigenous leadership table in our region. These leaders have written this recommendation. These partners and leaders know best what is needed to improve the well-being of their communities and have identified what supports will be required to do that. Further information and evidence to support this recommendation, including how the recommendation aligns with the Truth and Reconciliation calls to action, is found in our document, in our supporting document of the Board of Health report. We do want to thank all of our partners and leaders in the First Nation, Inuit, and Métis services for the vital work, the life-saving work that they do every day. In the spirit of further collaboration, Ottawa Public Health will be sharing this Board of Health report and the accompanying documents with the data, the analysis, the reviews with our colleagues across city departments to help inform and support their work within this space. Ottawa Public Health will continue to collaborate with our city department colleagues, such as individuals from Community and Social Services Department, OC Transpo, police, paramedics, and more, on the initiatives and the work they're doing to support the toxic drug crisis and the housing concerns. We have had and will continue to have significant collaborations with these city departments. We've worked with them on our recent Health and Housing Forum, the Emergency Treatment Fund, the work that's going on downtown with many community departments and city departments, and through our collaborative efforts with guiding council work to launch the new Anchor pilot. OPH works very closely with our city partners, and we will share this report to bolster their work in the area and to ensure that it aligns with our 10-year housing plan and our community safety and well-being plan of the city. So we'd like to take this opportunity now to highlight the 2025 key priorities identified by the Overdose Prevention and Response Task Force and other partners we have been engaged with and working with over the years. The priorities reflect the voice of our service delivery partners, people with lived and living experience, community associations, residents, local businesses, and represents work that is being undertaken collectively by these partners. The priorities moving into this year is a lot of work that needs to be continued and maintained. The work that will be highlighted and really have a big emphasis on will be work to enhance outreach efforts and service coordination, including improving access to treatment options and safer spaces, improving the patient experience in acute care settings and strengthening transitions to community-based care, advancing stigma reduction, strengthening data collection and surveillance, expanding overdose prevention initiatives, and other work to support communities around substance use health. Achieving these priorities requires sustained collaboration across health and social services, with community, with business, and sustainable funding is needed to maintain and grow these initiatives shared in tonight's presentation and in our report. Specifically for us here at Ottawa Public Health, we will be continuing to contribute to this work as well. Work that we will be contributing in 2025 includes building on prevention efforts to promote substance use health. For example, work in our healthy growth and development programs, CBT programs for new parents, Youth Connections Ottawa, and more. We will continue to work with partners to advance stigma reduction. For example, our work with City Studios, working with medical students from Ottawa U and journalism students from Carleton University. We will continue to coordinate responses to the toxic drug crisis through our drug alerts, convening partners on the overdose task force, and we'll continue to support ongoing surveillance, knowledge mobilization, and data sharing through our overdose reporting tool, our mental health addiction and substance use health dashboard, and more. And lastly, we wanted to end with this slide for a few reasons. One is we want to acknowledge and truly thank the incredible work of all the partners on the screen and many more that aren't represented here as well. The slide represents the different organizations in our task force and is a reflection that this work can't be done in isolation by one organization or one group. The task force and many others, including community associations, residents, business leaders, have worked extremely hard to inform and advance this work, the work that they're doing individually as well. The work is ongoing, multi-sectoral, multi-governmental, and we know that working together is the only way that we're going to be able to tackle this issue. So we just wanted to end with a thank you to all of these involved for their hard work, passion, and dedication to improving the well-being of people in Ottawa. Thank you.
Thank you very much for the presentation and for all the important work that you're doing in our community. We will move to delegations, and then we will go back to questions to staff afterwards. So our first delegation is Tali Magbu Cahill and Dr. Kim Corres. I believe they're joining us online. If you're ready, you have 5 minutes.
Wonderful. Thank you so much. Can you hear me okay? Okay, great. Thank you. It's a real pleasure to be here with everybody today. And I'm here with my colleague Tali from the Ottawa Hospital. And Tali, do you want me to go ahead and share my screen, or I'm not able to share my screen?
I trust you're sharing more than mine.
Can I get permission to share the screen? I'll go ahead and start talking, although we do have lovely pictures, if it's possible.
If you want to send us your presentation.
Oh,
I've
he's
got
figuring
it.
a way around it. We're good.
Yep.
You got that, Tali?
Yep. Got it.
Perfect. Thank you. Okay, I think people can see the notes at the bottom, that's all. Okay, it's a pleasure to be here. My name is Kim Crace. I'm here with my colleague, Tali Cahill, and we're here to talk about our work in the substance use disorders integrated care pathways that was touched on briefly in the introductions. In terms of, you can go to the next slide, Tali, in terms of why this work is important, as you are probably well aware, emergency department visits related to alcohol and opioid use are increasing in frequency, and people actually who visit the emergency department for alcohol or opioid related reasons actually have high levels of mortality and morbidity despite the care provided in the EDs. And unfortunately, they're not always well connected to substance use services post-discharge. So when you look at the surge in ED presentations and system pressures and health human resources constraints, plus the, increasing impact we see on alcohol and opioid use disorder and related concerns in our communities, there really is a need to get evidence-based interventions to the people living in our community. So the substance use disorder integrated care pathways work from the Mental Health and Addiction Center of Excellence in Ontario Health, as well as with leadership of Ontario Health, really was designed to establish integrated care pathways for people who are at high risk for poor outcomes related to alcohol or opioid problems, who are presenting to our local emergency departments, and make sure that they're really connected to care that addresses their needs, both in the hospital, and getting that evidence-based care to them in the hospital, as well as in the community. So we want to make sure that people who are coming to our emergencies and who are seeking care get access to high-quality evidence-informed care. We really build on those connections that we already have amongst all of us. You've heard that from Ben and team just minutes ago, and building those connections between EDs, hospital, and community service, ultimately reducing mortality and morbidity for those presenting to our merge with alcohol and opioid use concerns, as well as measuring those impacts so that we can see that the effort we're putting into this new pathway actually results in the desired outcomes.
So what this looks like, just as a visual representation of the pathway, is that you have the client coming to the hospital. The idea is that when they get to the emergency room, that their needs are treated kind of right away in terms of like withdrawal and trauma-informed care, evidence-informed pharmacological treatments. We take care of that person in the emergency room. That care continues to an inpatient admission if they're admitted to the hospital. When patients leave, whether from the emergency room or from inpatient admission, the big part of this pathway is making sure that they get to the right place and they're connected with all the amazing community services that exist. So not only withdrawal management and also rapid access addiction medicine clinics, but also with harm reduction. So we know this isn't all the services that people need to be connected to, but this is just kind of the beginning of getting people into that, the spectrum of evidence-based substance use healthcare.
So these are many of the partners that we're working with together on this pathway. We're in early days of this work, and we are working with Ontario Health on the next steps as we move forward. But here are the partners that we have working, and you can see we have many of the hospitals, here in Ottawa, as well as peer support, CAPSA, so people with lived expertise as well, who are leaders in this space, the local rapid access addiction medicine clinics, harm reduction services, Access MHA for coordinated access to services, as well as our partners with withdrawal management services at Montfort Renaissance. And then just given the catchment of who comes to the Ottawa Hospital, other areas outside of Ottawa, everywhere from, Cornwall and Hawkesbury and out towards Renfrew, Pembroke. So a real group of folks coming across the sector to make this happen so that we're all well connected and established to get people the care that they need wherever they are.
Sorry,
And so
are at 5 minutes. So if you could quickly wrap up in just a few seconds.
Surely.
Just letting you know what we're working on. We're still in early stages and working with Ontario Health about next steps about doing all of this wonderful work.
Great. Thank you so much. Let's see if you have any questions. I'm not seeing any. So thank you very much for being here today and for your delegation.
And thank you to all of you folks and for giving us the opportunity. Take care.
Oh, I have a question, sorry.
Oh, go
Yes.
ahead. Go
I
ahead.
was going to ask what types of collaboration is being pursued with the schools and higher institutions, because I hear a lot about. I'm not hearing a lot about preventive. It's more of are there any preventive measures with the schools?
Sorry, go ahead.
Yeah,
Helen.
I think it's a question about preventative measures in the school. So this pathway is focused on people who are presenting in to the emergency room who already use opioids or alcohol. So it's not really, the focus is in prevention beforehand in this particular integrated care pathway. But this is just a really specific focus on people who already use substances. If that answers your question.
Yes, it does. Yeah, it does. Thank you.
Thanks.
Thank you.
Wonderful. Thank you very much.
Thank you.
Thanks.
We'll move on to our next delegation, Suzanne Obiora, who is also joining us online. Whenever you're ready, Suzanne.
Oh, thank you. Thank you for that. And thank you for the opportunity to speak today. I'll first start by expressing deep gratitude to Ottawa Public Health for their overdose acknowledgement. It's another example of its tireless leadership in our city, and for the continued collaboration among many community partners across the city working towards overdose prevention and response. At Somerset West Community Health Centre, we see the impacts of this crisis every day on lives, on families, and on neighborhoods. And we take great care to serve communities in Ottawa facing some of the highest rates of drug poisoning, homelessness, and poverty. And it's in our commitments to continue serving our community that we have launched Ottawa's first homelessness, addiction, recovery, and treatment hub, which is a multi-partner initiative integrating health services and 6 mental health and substance use treatment options, including peer-based addictions coaching and rapid access to withdrawal management services, social services support, and permanent supportive housing for 6 individuals in Ottawa. Our model is built with and for the community, with a particular focus on supporting the individuals who have been accessing our consumption and treatment services since 2017. We've been incorporating Indigenous and Afrocentric approaches and building on the voices of those with lived and living experience of substance use as we create our model. And through proactive outreach and a no wrong door approach, our Heart Hub is responding to community needs with urgency, with humanity, with compassion, and with evidence. And since launching phase 1 of our hub on the 1st of April, we've focused on restoring trust and meeting basic needs. And that includes providing showers, meals, practical supports, health referrals, wound care to those who often have nowhere else to go. We are addressing the increasing community needs and ensuring individuals with health and housing challenges can access the care and support that they need to achieve community connection, stability, and recovery. And our efforts are not just about mitigating harm, but also about fostering a safer, healthier community for all. And we see this, we are seeing the impact every day. Our numbers in the hub are growing slowly, from 9 visits on day 1 of opening to 53 people visiting us yesterday, Sunday, April 13. And by the fall, we aim to fully launch a 24/7 operation where every interaction at the hub will focus on creating pathways to sustainable housing, ensuring better outcomes for individuals and the broader community. But I need to be clear, the Heart Hub was never meant to replace the consumption and treatment service. In this ongoing public crisis, we cannot deny the impact of the profound closure of our consumption and treatment service. In 2023-24 alone, our site saw over 8,700 visits, 26,000 interactions for harm reduction supplies, and 30,000 connections to basic supports. Every one of those interactions represented a chance to build trust, to prevent infections, to prevent someone from ending up in the emergency department, and to save a life. And we worry most about what we cannot see. As a result of this closure, we cannot see the hidden infections from reused or shared supplies, the quiet overdoses that don't make headlines, the missed opportunity to intervene early before someone ends up in the emergency department, incarcerated, or worse. We are talking about preventable deaths and preventable costs. These are human lives and system failures we cannot afford. Somerset West Community Health Centre, we align with Ottawa Public Health's urge in prioritizing investments that match the urgency of this crisis, to restore and fund services as part of a comprehensive continuum of care, not in isolation, to ensure continued ongoing investments that equip communities like ours with the resources to scale what works, like peer outreach or integrated treatment pathways that we are seeing through the Emergency Treatment Fund and that we will now see through the Heart Hub. And to ensure that data is used not just to describe harm, but to drive prevention. The numbers shown in the presentation earlier from OPH behooves us to do more. And while the Heart Hub is not a replacement for supervised consumption, it does have promise and we want it to be a success in our community. It can be the blueprint for what's possible when services are integrated, when equity guides design, and when people are treated with dignity. At Somerset West, we are committed to this work, and we are very grateful for the many partnerships coming together, including that of Ottawa Public Health, to achieve the best possible health and well-being for all in our community. Thank you.
Thank you so much, Suzanne. Let's see if we have any questions. We do, from Member Bauer.
Thank you very much for the presentation and for your eloquent plea around a continued continuum of care for your clients. 8,700 is, you know, an overwhelming number when you think about it. You talked about what we cannot see, but do you have a sense where those clients are going, those individuals who use substances, perhaps not ready for treatment services quite yet, in terms of their displacement to the surrounding neighborhoods or to other CTS sites that are still in operation in Ottawa?
Yeah, thanks for the question. We did survey 110 of our clients recently and learned that more than half of them are using substances in public spaces. 55%. This is from 110 sample. We did learn that close to 60% are interested in switching from injection use to inhalation. Where they will do that will vary, as we do not have supervised inhalation services available in Ottawa. Close to 60% have reported interest in seeking consumption and treatment services at other locations. There's some inconsistency in whether they are actually using at the 3 other sites, but have reported interest in doing that. I'll note that the other 3 sites are about 4 kilometers away from the Somerset West location, and many don't travel more than 500 meters or a kilometer to access the services. And then there were 60% that have voiced interest in some of the treatment options that will be offered at our Heart Hub. So a question mark around the 40% who are not yet there to progress into treatment options, but and at the same time hearing 60% voicing interest in some treatment options.
Thank you. That's very helpful.
Great. I'm not seeing any other questions, but thank you again for being here tonight, Suzanne.
Thank you.
Go to our next delegation, Sarah Taylor, also joining us online.
Can you hear me?
Yes, we can.
Okay, thank you. So thank you so much for allowing me to come this evening. I'm really excited and honored to be here to support the Overdose Prevention and Response Strategy Report. So my name is Sarah Taylor. I'm with the city's Community and Social Services Department, and part of my portfolio includes the stewardship of the city's Community Safety and Wellbeing Plan, which Ben spoke about earlier. Sorry about that. Now I have my video on. And I wanted to take a few minutes to really talk about how the incredible work that the Overdose Task Force has done and the strategy before you aligns incredibly well to the city's Community Safety and Wellbeing Plan. And so the Community Safety Wellbeing Plans are legislated by the Solicitor General and require every municipality within Ontario to have such a plan that really focuses on the social determinants of health within a framework they put forward of how we as a city and community think about prevention, risk intervention, and emergency response. And some of the guiding principles within that work is having a really strong evidence base. The concept of collective impact, which is the idea that the issues that we're facing as communities and societies are too big for one organization or institution to do on their own and really require a collective response. And a focus on equity and reconciliation. And all of those factors you see Ottawa Public Health in the report before you today really exemplify in their work. We currently have 7 priorities within the city's Community Safety Wellbeing Plan. This strategy helps support and touches on 3 of them. The first around mental well-being. You heard Ben and Christina and Kira talk about the launch of Anchor and the partnership that Ottawa Public Health played within that, as well as the data and information from the strategy and task force. Our collective efforts around the Emergency Treatment Fund application, as well as funding for the Downtown Safety Outreach Partnership, which was funding received through the Solicitor General, which is looking at enhancing and advancing the coordination of outreach within the downtown core, which is just going into its 2nd year of funding. And throughout all of those, Ottawa Public Health has been an incredible partner with community and social services, as well as you've heard from the other delegates, and bringing together and really creating a collective voice and using all of the information and knowledge available to us to bring forward impactful interventions that the community is facing at this point in time. Another incredible area of leadership is around our what's called the Integrated and Simpler Systems priority, which has a real focus on data. And when the Community Safety Wellbeing Plan was first developed from 2020 to 2021, one of the biggest gaps was that there wasn't enough community data. And so Ottawa Public Health leadership in putting forward the data that Christina talked about today, making it accessible, timely. You see in the report the value that it's bringing to community for grants and for other works. And it'll inform the update to the city's Community Safety Wellbeing Plan, which is ongoing this year. And lastly, really supporting the recommendation, all recommendations, but in particular around a sustained funding source. The data speaks for itself in Suzanne's presentation, and really look forward to your support as a board in putting that forward to the province to deal with the crisis that's ongoing in this community. So in closing, I really want to thank Ottawa Public Health and Ben and Christina and Kira for their ongoing work, their collaboration. They're bringing partners together in a really meaningful and impactful way, and the report before you today. Thank you.
Thank you very much, Sarah. Not seeing any questions. You have a question? Oh, my apologies, Member Carr.
Thanks very much, Chair. Thank you very much for your presentation, Sarah. And thanks for referencing the community safety and well-being, which I know that you're doing great work on. When we hear about the updates on the overdose prevention and response strategy, there's acknowledgement of how interconnected this strategy is and how we need a multi-sector response to this crisis. There's discussion about the affordable housing piece, about the social disorder piece, and reference to a number of initiatives that you've also referenced with respect to core strategy, CSWB, a lot of the other initiatives underway. Do you see the community and safety well-being plan as that overarching city piece at, at that leadership level to really pull together that sort of integrated mental health and substance abuse strategy that's needed? Like, is the CSWB the sort of the integration of all these pieces with policing, public health, in order for us to really get to that multi-sector prevention piece, do you think? Or do you think we need more?
Thank you for the question. So when the community safety, so a number of the things within the overdose prevention strategy are referenced in the existing community safety wellbeing plan. And we are in the process of refreshing it this year, as the legislation requires that we refresh it every 4 years. So one of the conversations we'll be having with Ottawa Public Health and Ottawa Police is the role that the community safety wellbeing plan can play in exactly what you're asking, while also allowing and making sure from a governance perspective, for example, that the overdose prevention strategy and work of Ottawa Public Health continues to report here and come here. But how can we put together a more holistic picture of all of the pieces that are currently occurring in the city to give that full view to residents and council is something that we're looking to do within the update because of all of the amazing work that you just heard about today, the core strategy and other pieces that have happened since the plan was initially passed in 2021.
Okay, thank you very much for that. Appreciate it.
Thank you, Member Carr. I'm not seeing any other hands up, so thank you, Sarah. Appreciate you being here tonight. Our next delegation is Sergeant LeMay, who is joining us in person.
Good afternoon. Thanks for having me. So I was invited before you today to speak about our core strategy with the Ottawa Police Service. It was launched almost a year ago in the spring of 2024. Essentially, it's a multifaceted strategy with the base being the Neighborhood Operations Center on Rideau Street. From that, we have several committees that meet on a regular basis, and one of them, which includes Ottawa Public Health, is the Frontline Task Force. So Frontline Task Force was created within the first couple of weeks of this core strategy. It's meant to be an action-driven group that meets, we used to meet once every second week. Now, moving forward, it will be once every 3 weeks. The other partners around the table are bylaw, Ottawa Public Health, as I mentioned, paramedics, as well as the community engagement team. So together, we pretty much address what the issues are that we're seeing on the field and how we can approach them and develop solutions. Another product of the core strategy is the integrated community situation table, which partners as well with the Sandy Hill Community Health Center. Again, with conversations happening about how individual cases can be helped by more than 30 partners, one of which is Ottawa Public Health. And of course, as we all know from the core strategy, we have from an enforcement perspective and community engagement with the Ottawa Police Service, the hotspot policing. So those are 2 shifts of officers coming in on overtime and targeting enforcement and again, community interactions in specific areas that are right now identified in the Bywood Market and the Rideau Street corridor. And again, the knock is used regularly by our officers. There's a lot of foot traffic. We see a lot of the issues that were presented to you this afternoon, and we do our best to be a partner in the approach and the mitigation of the effects that it has on everybody. And that's my presentation.
Great. Thank you. We have a couple questions for you. Member Gower.
Thanks, Chair. Thanks for being here. One of the assertions I've heard is that the focus on the Byward Market and Rideau is displacing issues to Centertown, for example. Is it, in your opinion, doing that? And is there any strategy, if it is happening, is there a strategy to minimize just displacement of issues to other communities?
So we've certainly heard that as well, and we're not obviously insensitive to it. It was anticipated that there would be a concept of dispersion of the issues that we were trying to tackle, but also diffusion of the number of issues that we were seeing in the Byward Market and the Rideau Street corridor. Paul Stam, who's the main officer behind the strategy, could not be with us today, but the update that he would have to share is that the group is focused on Core 2.0, and that will include some patrols in the Centertown neighborhood, as well as an expansion of the areas in the Byward Market and more shifts as well. So better prolonged period of time and more days of the week will be covered by the upcoming phase of the core strategy and the hotspot policing patrols.
Okay, thank you. Thanks, Chair.
Thank you. Member Bauer.
Thank you, Constable May, for being here tonight. As a resident of Lower Town, I know you've been on this file and a community liaison officer for my neighborhood for many years now, several years at least. You'll probably be at our Lower Town Community Association meeting later tonight, so your support is very much appreciated in our neighborhood. From your experience, from sort of a historical perspective, have you seen the shifts of usage, the crime rates in Lower Town and Sandy Hill, and the implementation of the core strategy? Could you point to one thing that in core that is having a real impact, in your opinion, on the situation on the ground now?
Thank you, Member Bauer. And as you've said, it's been 8 years that I've been serving the Lower Town community as its community police officer, and I'm now the acting sergeant for the Central District. So to Member Gower's question, again, I'm more in tune with the impacts that it has in the Central District, which ranges from obviously Centertown all the way to Vanier now. I've seen a positive evolution in the approach that we have in regards to these social disorder issues. And I can attest based on the community feedback feedback that we're getting, that certainly the effects of the hotspot policing shifts in the core strategy in general are very positive. In terms of the number, I apologize, I don't have the numbers with me. Again, as I mentioned earlier, we can appreciate that there is some dispersion, but also some diffusion. So those are all factors that are being considered and weighed in for the upcoming evolution of the core strategy.
Great. I don't think we have any other questions, but thank you again for being here this evening.
Thank you, Chair.
Our next delegation is Calla Barnett joining us online. Whenever you're ready, Calla.
Hi, okay. Thank you. So good evening, everyone. I appreciate the opportunity to speak today on the report or the report on the strategy. In November 2023, I delegated on the same item. My delegation then focused on misrepresentation of resident concerns. I was invited back today following ongoing meetings with the Chief Medical Officer and members of the CMO office. We have done good work together, and I have some positive comments about the direction of the strategy. But, you know, I'm me, so I have critiques as well. So notably, before I get into it, I experienced privilege as a white cisgendered woman, but I also experienced oppression as a queer disabled single parent. So we'll start with the good stuff. So the increased focus on treatment and housing through the Heart Hubs, but also the Ottawa Hospital Pilot Program, alongside the goal to ensure that people who use drugs have access to treatment upon request are excellent updates. I strongly support them, and I'm thrilled to hear that there's been a sort of branching out to treatment, and that the lack of access to treatment is being taken seriously. The new outreach and funding proposals are solid steps forward, and I work with CSSD and OPH regularly to ensure that outreach responds to the needs of residents and people who use drugs. So that is a collaborative thing that I enjoy participating in to help this community. Finally, the recognition that the overdose crisis and the toxic drug supply is impacting residents in neighborhoods where services are located is a very welcome change. I want to thank former Chief Medical Officer for her willingness to engage with us, as well as the CMO office staff and the harm reduction staff, Ben and Kira, and the interim CMO for continuing with those efforts. So now it's time for the criticism. Sorry, folks, it's always going to be there. They frame our conversations with and hopefully it frames the conversations with the CMO going forward. So first, the enormous amount of time and effort that I have put into unraveling city governance so that somebody takes responsibility for the issues we face is absolutely ridiculous. I spend so much time explaining and re-explaining the issues, undoing misinformation, like that 500-meter statistic. That's based on a study that was done in the downtown east side 6-7 years ago. Nobody's done any more studies. That statistic is irrelevant. So I have to keep doing it, and it's ridiculous. But those things are not clearly articulated anywhere by the city. And so I would like to find a way to make sure that all this other information that I have that never ends up in a report ends up in a report somehow. Residents witness and experience all manner of traumatic events, including human trafficking, violence and gender-based violence, death threats, break-ins, thefts, increased shootings and stabbings, now both fatal and non-fatal recently. We also intervene in overdoses with no support. Sometimes the overdose victim is violent upon revival. We are not traumatized by open drug use or trespassing or whatever it says in the report. This is a very clear distinction I need to make. We're traumatized by the refusal to address these issues and a lack of acknowledgement and overt response to the violence that we endure. A significant issue is the way information is presented. Local evidence document that you all got indicates that most people who visit emergency departments for ODs live in the downtown area, and that most opioid deaths occur there as well. But the majority of people in the downtown area experiencing the substance use crisis stay in the shelters. They're in the shelters. They don't live here. They stay here because this is the only place that there are shelters. So it's a misnomer to say that it's because of the concentrations of services that are downtown. It's not because they have housing here. There's not like a ridiculous amount of people who live in social housing using drugs. Like, that's not what's happening. They're in the shelters. They're forced here. Nobody wants to be here. So finally, there's no mention of diversion or calls to regulate prescribed alternatives. It's a serious issue that has contributed to the loss of multiple businesses along Rideau Street, including a local business that had been at that site for 42 years. That does not come through in the report. But to my knowledge, 18 8-milligram dilaudid pills, named randomly according to Safer Supply Ottawa, are prescribed and dispensed to a single individual every 2 days, and they have become currency. I have seen them traded for food, medicine, fentanyl, etc. They are sold. We find prescription bottles on the grounds of our schools. We know that opiate use doubled among children, right? From grades 7 to 12 between 2021 and 2023. Notably, Safer Supply Ottawa, with Pathways to Recovery, OICH, Recovery Care, and Respect RX, they started working in 2021. The political climate is changing. The Ford government and the federal government, whether it's liberal or conservative, are changing the way they want to address this. Our tactics need to shift. Spread services equitably through the city so that they stop being our burden. These problems can be diluted. They can be diffused.
Ellen, you are at 5 minutes. If you could just wrap up quickly.
So they need to be addressed safely for everyone. With all of these outstanding issues, we are nowhere close to finishing our work with OPH. I appreciate the efforts you're making. I just want to continue to support the efforts with you moving forward.
Thank you very much, Kella. Not seeing any questions for you, but we really appreciate you being here today. Thank you. Our next delegation is Susan Gazali, also joining us online.
Is it my turn?
No, it's Susan Gazali. Yep.
Sorry, Chair, I apologize. Go ahead.
Hi, everyone. Thank you for having me here. I was a last minute addition. I'm not particularly happy to be here because, you know, I've had to advocate a lot for my community as a resident of Sandy Hill to get more supports for residents who are impacted by what you in the city call harm reduction. So in light of that, I've taken a couple of bullet points. Kala has already raised some issues, so I will just sort of take the baton from her with thanks. I would decide to join tonight after reading the article in the Ottawa Citizen, and I was alarmed by what seems to me to be an intention to double down on harm reduction programs. And my fear that they will be expanded in this ward, because currently we now have nearly 50% of the injection sites in the whole province of Ontario. That is a problem. I'm also repeatedly disappointed by this city because despite my many interventions through my current councillor, my previous councillor, direct channels with the mayor, various people on the city, we're not getting the results that we need. So when we talk about harm reduction, or at least, sorry, when people in the city of Ottawa talk about harm reduction, they're talking very specifically, they have a very parochial definition that talks about harm reduction for people who use drugs. But what about the people who don't use drugs? When the idea for harm reduction was first espoused, it was spoken to our community as an idea, as a proposition that this would lower the risks and the harm to people, residents here, as well as to people who use drugs. Yet before any of these sites opened, I never saw anyone publicly using drugs. Meanwhile, today I had to pick up a crack pipe that is in my laneway where I live with my 2 small children. This is unacceptable. And I'll tell you another thing that's unacceptable. When I was previously involved in my community association, I sat on the leadership table with the city and I said, you know, here are some gaps that we have in the community, because if you are so intent on redlining all of these services in my community, where are then the commensurate supports? So I said, well, what do we do about things that are also health concerns, such as discarded needles, discarded crack pipes that are now on private residences? Nothing happened. What about the human defecation? Because what no one talks about is that violently defecating yourself, often in public, is actually a consequence of withdrawals. So what happens to that? The city has no plan, but despite Ottawa Public Health telling us that they would explore this issue in 2021 to come up with some measures to help residents, that has not come to fruition. So for me, all of this talk is very ideological. You give me data that is pretty dicey. So I will leave that there. But what I will say is, where are the programs and where are the studies that are examining the harm caused to our communities? Have you examined the effects of your approaches for residents, families, and the children who live here? What about the trauma that everything associated with publicly using these drugs have on us? I tried, I think it was 2 weeks ago, I took my kids, they're 4 and 6 years old, to dinner with my husband. And on our way back, there were people who'd completely overtaken the sidewalk, were sitting in a circle, smoking fentanyl, and we had no choice but to walk through them because there was no other place to walk. Otherwise, we'd have to go onto the busy King Edward. So what about the rights of me and my children to not have to be forced to to inhale secondhand fentanyl? Can you tell me what studies have you done on the impact of secondhand fentanyl smoke? What happened to the legislation about the smoke-free Ontario? The kids cannot play on their own property because there's crack pipes even on our laneways. They can't play at parks. We have these things showing up at schools. What are the plans by the City of Ottawa to actually have measures that improve the quality of life, that reduce the psychological, the physical, and the mental anguish that the concentration of these services exclusively for a population of predominantly able-bodied white men between the ages of 39 and 45 are being inflicted in our community? So thank you again for having me here. I'm not happy to be here. I think it's unreasonable that residents like me, myself, Kala, Anya Fraser, that I think you'll hear about, have to come to these meetings on our personal time to ask for help that we don't even receive. And you get my tax dollars. Thank you very much.
Thank you, Susan, for your delegation. I'm not seeing any questions, but thank you for being here. Next delegation, conseillère Plante, c'est à toi.
Oui, merci beaucoup, Madame la Présidente, et je m'excuse là pour l'interruption que j'avais faite auparavant. Bonsoir tout le monde, j'espère que vous allez bien. Merci de m'avoir reçu ce soir. Je sais que vous avez un horaire assez chargé, alors je ne vais pas prendre trop de temps. Je n'ai pas vraiment préparé des commentaires, mais je vais essayer de faire ça vite. So I read this report last night. I had some thoughts, and I'm only going to share 2 of them because I think they're absolutely the most important. So the first one is, you guys had a slide with logos on them, right? With all of the partners. And I did not see the logos of the provincial and the federal government, although I'm sure you're in contact with them on a regular basis. I'm assuming about this issue as well. I think, and I'm going to expand upon what Kella Barnett talked about. We know the landscape on harm reduction is changing drastically. The Premier has said there will be, no more there'll be no more consumption sites in Ontario. There was talk about expanding it to inhalation. That is, we know that's not going to happen. We know that's not where the money's going. I have heard just personally myself that Prime Minister Carney is not in favor of expanding these either. You'd have to confirm with him, but that's what I've heard. We know how Monsieur Poilievre feels about this. So I would urge you to kind of rethink this in the context of the political climate, because it is going to affect not just our downtown neighborhoods, but the way we approach harm reduction in the city as a whole. The other one, and I really wanted to give a virtual high five to member Asia for, I hope I pronounced that properly. She talked about where's the prevention? Where's the prevention in schools? And that is an excellent question. So this morning I fielded a call from a parent, a very nervous parent, just recently arrived in Canada, who had found on his child's Snapchat someone who was offering drugs and the sale of drugs. The child, I think, is 13 or 14 years old. Obviously, that's very worrying. And when I go on the OPH website, I do not see anything about prevention. I don't see anything about awareness for parents of where kids are buying drugs or how they get their hands on them, or if they even have an understanding of what they're procuring. You can go on Amazon right now. You can get a pill press for $30. And this is very, very concerning for me, because your data is showing an increase in use among youth. And we really need to educate youth about what is out there, what they could consume. And you can just Google the very sad story about Mathis Boivin in Montreal. He took one pill one time and He did not wake up from that, and his parents have to live with that forever. So those are just my 2 points. Last, I just wanted to give you guys a quick update on what we've been doing in the wonderful Ward 12 office. So myself, what's called the Greater Harlem Coalition, and Compassionate Kensington, which is in Philadelphia, we have met several times. We share similar demographics in our neighborhood. The Americans refer to it as redlining, which is when you take a specific population, you say to that population, you have to live here, and you create policies around that to make sure that population only stays in that one neighborhood. We don't really have a similar word in Canada, but that's the word that they use. We also care very much about our neighbors who continue to struggle with disproportionate, systemic, generational, economic, social, and safety disparities. This is a mix of things that concern us on a regular basis. But I just wanted to read you a letter that was sent to the Attorney General of New York, Letitia James, from the Greater Harlem Coalition. All you need to do is replace Harlem with Lower Town, replace New York with Ottawa, and it's the same, literally copy paste the same story. So, dear Attorney General James, I'm writing to draw your attention to a situation that is currently threatening the mental health and emotional well-being of children in Harlem. Each day, Harlem children of all ages observe people in extreme distress whose behaviors include self-harm, erratic outbursts, public defecation, and violence. They often walk in close proximity to people who are in crisis. This is occurring as a direct result of the extreme concentration of methadone clinics and related services that all have been sited a few blocks from each other. These sites are often right next to preschools, daycares, elementary schools, making it impossible for children and families to avoid these disturbing scenes. I'm not sure if you're aware on the literature of vicarious traumatization, but it has been well documented that people who are exposed to other people's trauma often experience the same psychological symptoms. I'll sort of switch to the end. I offer the above evidence that the oversaturation of methadone clinics and related services in Harlem is creating a mental health crisis for children that is potentially as severe as the crisis of substance use in New York City. The children of Harlem are now being forced to experience a form of traumatization that can be as powerful as being the direct victim of a traumatic event. The mental health impacts of this cannot be mitigated by supportive families, schools, or other factors. By allowing the sitting of such facilities so close to schools, children will experience the pain of vicarious trauma with the effects that last a lifetime. I urge you to research the issue of vicarious and secondary traumatization, and it goes on. So very interesting. These 3 communities are all experiencing sort of the same effects. And I wanted to thank you again for having me here today. Merci beaucoup, Madame la Présidente. Tu fais un job exceptionnel ce soir. Merci beaucoup.
Merci beaucoup. And thank you for being here right on time. Not seeing any questions for you, but merci beaucoup pour être ici. Our next delegation is Anya Fraser.
Hi, can you hear me?
Yes, we can.
All right. So thank you for this opportunity to talk to you as a new mom and Sandy Hill resident about OPH's overdose prevention and response strategy. I read yesterday's article in the Ottawa Citizen about how the interim medical officer, Dr. Arneson, is calling on the provincial government to provide OPH with more long-term funding for overdose prevention programs and related harm reduction services. According to him, the 2023 OPH data on opioid-related deaths in Ottawa shows that there is a pressing need to double down on these types of services. But while the article made a compelling case, I couldn't help but notice something was missing. He exclusively talked about how the drug crisis and these services affect people with lived and living experiences, with zero mention of how non-drug users might be impacted. So I went on to OPH's stopoverdoseottawa.ca webpage to see if I could find any acknowledgement of how overdose prevention programs and harm reduction services impact people who live and work near where OPH locates these services. Your webpage stresses how OPH's plan is evidence-based, uses best practices, and leverages the expertise and experience of all partners in the co-design, except that none of your community partners appear to represent housed residents or businesses. And OPH doesn't appear to track any data that shows how these services are impacting nearby residents and businesses. Yes, drug addiction is a health problem. No one here disagrees with that premise. However, unlike hypertension or PCOs, which inflict harm mainly on the individual who experiences them, the consequences of drug addiction harm not just the individual using drugs, but everyone around them. Social disorder, crime, abuse impacts everyone. Drug addiction is indeed a very public health issue, and yet OPH staff and decision makers overlook these broader health concerns for members of the public. Whenever you hear statements from the interim medical officer of health or read information released by OPH regarding overdose prevention programs and related harm reduction services, they exclusively talk about people with lived and living experiences as if they exist in a separate bubble unto themselves. And while yes, people with lived and living experiences are the ones most directly affected by the drug crisis, they are not the only ones experiencing harm. OPH policymakers made a strategic decision to locate these services almost exclusively in 2 wards, 12 and 14, specifically Somerset West, Vanier, Sandy Hill, Lower Town, and the Byward Market. These are densely populated urban neighborhoods and commercial areas. We are considered diverse neighborhoods. So a lot of us here are low income, disabled, racialized, LGBTQ, single parents, etc. And we have a lot of small independent businesses. So we are especially vulnerable when it comes to street level drug related crime and social disorder for a variety of intersectional reasons. Since OPH located these types of services in Sandy Hill, open drug use has imploded in my neighborhood, and we are being harmed. I don't have time to get into all the ways that our families are being harmed by this. Other delegates have touched on that. But whenever residents and businesses complain about the impact of OPH's programs, we are written off as reactionary and anti-science NIMBYs. A lot of OPH policymakers believe that the answer to this public pushback is that residents and businesses need to be better educated. We need to understand that these programs are evidence-based. So I'm coming to this board today to ask for that evidence. I am pro-science. I believe the earth is round, that global warming is a thing, and that vaccines work. So please share all the peer-reviewed studies that demonstrate how locating overdose prevention programs and harm reduction services in densely populated urban neighborhoods and business districts poses negligible risk of harm to everyone who lives and works there, not just the people with lived or living experiences. I want to see all the quantitative and qualitative data that proves that locating harm reduction services in residential neighborhoods has zero negative impacts on residents' mental and physical well-being. And I want to see the GBA Plus analysis that investigates how diverse low-income neighborhoods are impacted by concentrating services for people with high acuity needs there. I'm not asking for OPH to undertake a new study on this. I just want you to assign a junior analyst to do a basic literature review of all the peer-reviewed articles that exist on how these services impact nearby residents and businesses. OPH claims your overdose prevention and harm reduction policies are evidence-based. Great. Then show me the receipts.
Great. Thank you for your delegation, Anya. I'm not seeing any hands up, but we appreciate you being here tonight. Thank you. Our final delegation of the evening is Councillor Ariel Troster. Whenever you're ready, Councillor.
I apologize. I was on mute. You think I'd be better at this. So thank you so much, everybody. Thank you, Chair. Thank you to the members of the Board of Public Health and to all the delegates. So for those who don't know me, my name is Ariel Troster. I represent Somerset Ward in downtown Ottawa. We are one of the neighborhoods with the highest rate of overdose in the city. And we are also the community where a supervised consumption site was closed forcibly by the Ford government about a month ago. That decision, which was not one we made as a city or as a community, it was one that was imposed on us, has had an absolutely disastrous effect on the nearby community. Within hours of the closure of the supervised consumption site, we suddenly got reports of people using drugs in ATMs, in people's backyards and alleyways. Now I'm hearing about groups of 10, 20, 30 people gathering drug paraphernalia found everywhere, including in a baby carriage this week. Because not only was Somerset West forced to close the supervised consumption site, the nature of their contract for the Heart Hub, which they were building, prevents them from doing any harm reduction work at all, which includes no supervised consumption, no needle exchange, and no safe supply. And something else that has happened is that since the supervised consumption site closed, a private clinic called the Northwood Clinic which was frankly chased out of Hindenburg, has now moved into Chinatown, and they are prescribing safe supply, but without any of the guardrails that were in place and any of the community accountability that were in place with Somerset West Community Health Center. So similar to what you've heard about in other neighborhoods, we have folks leaving the clinic with large quantities of Dilaudid on them. It's been documented that that Dilaudid is being diverted. It's led to an increase in crime. There have been several arrests and frankly, utter chaos surrounding the clinic. So I want to be really clear. The supervised consumption site was a solution, and its removal has led to absolute disaster in the neighborhood. I think we underestimated how it kept the addiction problem contained, because if safe supply was prescribed, folks could consume it on site. There was a wall. Yes, there was a spillover effect, but it was nothing like we're seeing now. And so I'm very concerned because, as Councillor Plante said, it looks like governments are moving in a new direction away from supervised consumption. I fear that this powder keg could get worse in every single corner of the city. And I'm very, very worried about what things would look like without supervised consumption. I think it is a misnomer to blame them for public drug use. I think they keep a massive public drug use problem contained. This is the evidence that we've seen. So in addition to this, we've heard from the Centertown Community Health Center, which is on the other side of my ward, closer to Bank Street. While they don't have supervised consumption, they do provide harm reduction services. They are completely overwhelmed because Somerset West is prevented from offering those services. They are now saying they have to hire 2 new people that they don't have funding to hire. They are absolutely losing it. We've seen an uptick in crime. There were 2 break-ins just overnight on the weekend. People are enormously frustrated. And the issue of public drug use is not going away. It's getting worse. It happens in front of my daughter's school. It happens in people's yards, sidewalks. And we really just don't have a good solution to it. Because if people who use drugs don't have a place to go, if they have an addiction, that means that they have to, if they're inhaling fentanyl, they need to inhale it 6 or 8 times a day. They're going to do it. Human beings are wired to survive. And we, right now, we have no safe place to send people for injection or for certainly not for inhalation, because no such thing exists. So, I'm really interested in hearing what OPH's plan is, because should the other sites be shuttered, how are we going to deal with this crisis? Is the city prepared to step up and to run these sites? Is the city prepared to potentially use federal funding to run a site of this nature if the province is not allowing us to do so? Because at the end of the day, we are the level of government closest to people's lives. We are being asked to act. I don't have tools at my disposal to help, and it's enormously frustrating. I've been very grateful for the Anchor program, which has been amazing, but what we're missing is proactive outreach, the ability to send people anywhere, frankly. I apologize, that's my dog. I'm really glad to hear from Officer LeMay a recognition of the displacement that has been a knock-on effect of the core policing strategy in the market. I'm not saying it's a bad strategy, but spot policing in specific parts of downtown is having the effect of pushing more troubled people into Centertown and frankly deeper into residential neighborhoods. And so I've been advocating for treating the entire downtown core as one ecosystem. I know Councillor Plante has expressed interest in having the Anchor program extended into the market in Sandy Hill. And I know my residents are asking for the core program to be extended into Centertown. We can't just chase people from one community to another. So anyway, thank you very much for this report. I just wanted to give you a bit of the human face of this crisis, because it was already really tough in my ward, and it's worse than I've ever seen it. And I'm really grasping at straws because I don't have a solution for people, because the changes in Chinatown were imposed on us. And it's left us worse off. So I would really warn community members that are speaking out against all harm reduction initiatives that this could reap more chaos. We need solutions that include harm reduction and treatment. This is a both and, not an either or. So thank you very much, and I'm happy to take any questions.
Thank you, Councillor. We do have a question for you from Member Gower.
Thanks, Councillor, for being here. You had a pretty big question there that you want to ask Ottawa Public Health, and it was, I want to just make sure I'm understanding, because I'll ask it on your behalf, but if the province says no to, my understanding of your question is if the province says you cannot run supervised injection sites, but that the federal government makes funding available for supervised injection sites, you're asking if OPH would run them despite permission, without having permission from the province. Can you just clarify?
Yeah, I mean, that's part of my question. I think what I want to know is what is the city prepared to do to fill in the gap, especially when community health centers are being legally prevented based on their funding agreements from providing harm reduction services. Should this happen to other community health centers? Should we continue to see these really poor impacts? How far are we willing to go as a city? Are we willing to follow the evidence, or are we simply going to acquiesce to the political flavor of the day? You know, your report is based on evidence. I will recognize that there are absolutely community impacts of public drug use. It's terrible. It is not a good thing. But we know that a lot of these types of services save lives. That's what the statistics show. And I can explain what is happening in my community, which is that the removal of this service has made these public problems that children and families are seeing so much worse. And I fear if the other sites are closed, we are going to see a crisis that this city is not prepared for. And I would really encourage the Board of Public Health to start thinking in terms of contingency about what we are willing to do, because if we don't act, I'm really fearful for what it's going to look like on our downtown streets and seeping into many other neighborhoods.
Okay, thank you.
Great. I'm not seeing, oh, Member Carr.
Hi, Councillor Chester. Thanks for being here. Just as you were talking, I'm was thinking about the fact that the safe consumption site at Somerset really only ever covered off the injection, correct? Because inhalation was never allowed. So you already probably had inhalation, public use for inhalation on the streets, and now you're seeing an uptick in injections on the street as well. Is that correct?
Yes, that's correct. I mean, I spoke just today to the manager of the Scotiabank at the corner of Bronson and Somerset. They're having to close their ATM now. They're going to be locking it after 5:30 p.m. because it's become a de facto consumption site. So now my understanding is that Somerset West and the other health services have been pushing the province and the feds to say, look, more and more people are moving to inhalation. That is where the deaths and the overdoses are occurring, which is what we see in the report that OPH put out. We need a solution for that too. And the answer, again, has been no repeatedly. So, you know, I just want to be clear. I don't think harm reduction is the only solution. I think it's one of many solutions. And I think it's the beginning of a healthcare path for people who might want to access treatment in the future. But to trade one approach for the other has left a gaping hole in the community. And I cannot describe to you what my inbox has been like in the last 6 weeks. It's appalling.
Yeah, no, I appreciate that. Is there any chance that I can ask you this offline as well, that you've been in touch with municipal counterparts in other cities impacted by the closure of a safe consumption site? Like, have you talked to any councillors that are experiencing this in Toronto or anything else?
So we are a bit of a guinea pig because this supervised consumption site at Somerset West closed a month earlier than the others because of the renovations that they needed to make to the building for the Heart Hub. So the other sites only closed about 2 weeks ago. So I think we're going to start to see the data come out of those sites. I think we're a bit of a canary in a coal mine. My intention is to connect with those other councillors. You know, I know I probably can't change the province's mind. They seem very determined to go along this path. But I do think as a Board of Public Health and as a city, we have to really think through what our strategy is. And if one funder pulls out and the need is still there and the chaos is there and it's causing a huge uptick in use of paramedics and police and all of these other city services, are we willing to do the brave thing and say, no, we need this service and we're going to run it? You know, I'm putting that question to you to think about. It's not obviously not something to answer today or anytime soon, but I am really worried. I want to sort of be the warning to you because I can tell you what happened in Chinatown, what is happening in Chinatown right now, you know, and this Northwood clinic that's administering safe supply, they're a perfectly legal medical clinic. You know, I have no tool to shut them down. I have no tool in regulating them. And, we're going to continue advocating to the province for a solution. But again, they've come in to fill the gap. They're doing it worse. So now we have the added problem of drug diversion, dealings, robbery, violence, and public drug use happening, all again in a very concentrated urban neighborhood. And so, the province purportedly shut down Somerset West because of its proximity to daycare. Now we're finding needles in baby carriages, and like kids are seeing this stuff at the bus stop and right beside their schoolyard. Like it's closer to them and it's more dangerous than it was before.
Yeah, no, wrong button. Yeah, appreciate that. Thanks very much, Councillor Troster, for sharing your experience. Thank you.
Yeah, thank you.
Thank you, Councillor Troster. There's no other hands up for you, but thanks for being here tonight. We appreciate it. So that was our final delegation. So we will go back to questions to staff if the team wants to come back up to the mic. Great. Member Gower.
Thanks, Chair. So I'll ask the question on behalf of Councillor Troster. I think she articulated the question well. Essentially, it's how far would Ottawa Public Health be willing to go? But I'd just like to hear from Ottawa Public Health. Have you given that question any thought? How might you make a decision like that? Anything that you could share with the board? Thanks.
Thanks very much for the question. I'll let Ben speak to the ongoing work, but first I just want to preface by saying that much of the service delivery, as you saw on that slide, the vast majority of the service delivery is done by partner organizations, and much like Councillor Troster referenced to the Safer Supply clinic in our community, in many cases this is not something that we have oversight in or even the ability to have knowledge in terms of their locations and what services they're going to provide. But I'll let Ben speak to our ongoing plans and what's described in the report.
Thank you. It's a question that we would be bringing back to the board. It's something that we would be having ongoing conversations with our partners. We're working currently with, as we saw from the slide, a large group of people, and it's an all hands on deck situation. We have our emergency services partners doing incredible work with CORE. We have Sarah Taylor, who spoke earlier about the work with SolGen, about increasing outreach services and looking for a coordinated approach. It's a situation where we're currently in the midst of it, and we're working very hard as a collaboration of partners to address it. In terms of specifics on what we would do, we would certainly be bringing that question here, and we would be looking to the board for direction. And the other important piece that Trevor just mentioned, and I think it is worth mentioning again, Ottawa Public Health is one player, one partner, one piece of a very big set of things that's needed. Housing cannot be understated, the importance of housing in all of this. The work that's happening with prevention, it was mentioned earlier, a tremendous amount of work is happening by incredible partners in prevention, including work at Ottawa Public Health with healthy growth and development. And this is not a one small piece will make a major difference. Many small pieces together will make a difference. And so as Ottawa Public Health, we don't have accountability, legislation, or authority to direct other health partners or health services. And in terms of location specifics or hours of work or the services that are provided by other health authorities and health service providers, that's outside the purview of public health. So we're one of the partners at the table, and we're proud of the work of our team members working in a really difficult time and in a difficult topic area. So the specifics of what we would do certainly would be bringing it back here and looking for the guidance and direction of the board and looking for the guidance of our residents, our community associations, our partners, and how we tackle this together. Thanks.
Yeah, thank you. I appreciate we're talking a lot about partnerships, and that's absolutely the right approach. But I think there's probably some frustration from a lot of stakeholders that there is no one single body that holds responsibility for this. Might be easier if there was, although in this circumstance, the complexity of the problem, I mean, it'd be impossible for one organization or entity to own that problem. So, yeah, but I think it's leading to a lot of the frustration in a number of ways that we're seeing here. So, definitely something for our board to think about, because it may be a question that comes back to us sooner than we think. So we'll see. I may have some more questions, but I know there's a lot of other hands. Thanks, Chair.
Thank you, Member Gower. Member Bauer.
Thanks very much for the report. It was quite comprehensive and very much appreciated the underlying evidence base to the updates. On the evidence, I think as the report shows, we're seeing a slight decrease in overdose deaths recently. I've read national reports in the media about some jurisdictions in Canada decreasing the same, experiencing the same decreases, whereas others are actually increasing, such as the province of Quebec. I just wondered if, and I know it's multi-causal, and it could be related to the drug supply or the particular intervention efforts. I just wondered if you had any insight into perhaps what is happening on the ground here in Ottawa to account for that decrease.
Sure. I'll kick it off and then pass it to my smarter epidemiology colleague. I think you touched on something incredibly important in there, which is the toxicity of the drug supply. It is absolutely impossible for us or anybody to speak to a future state or a past state without acknowledging the fact that the toxicity of these drugs is something that we've never seen before. And it is absolutely impacting the rates in a negative way and sometimes in a positive way where we might see something. There isn't specificity or clarity there from us about 1 week why we're seeing a certain drug in our community and another week another. So that is absolutely impacting the rates. And other things that we know about are social determinants. So housing, the trauma that many face during COVID and after COVID, the ongoing needs of our community with other social determinants. So it's difficult to sort of parse out one single element outside of the toxicity of the drugs. I will say that there's no doubt that the efforts that our partners are making are contributing to people getting to treatment in a more comprehensive way. There's no doubt that wraparound services make a difference. There's no doubt that treating people with compassion and respect when they enter into the hospital or into any treatment provider is making a difference for the journey of that person. To what degree and how much of a percentage does that change? Unfortunately, we're not able to speak to that, but we do know from speaking to people with lived experience with providers that these are the things that make a big difference. But I think it's really difficult for us or anyone to say with certainty that, this one initiative reduced by this amount. I think that would be not an evidence-based way to look at it. But I will say that we know from people how we provide the services, the accessibility of services, the cultural appropriate nature of the services. These are all making a huge difference. And I'll pause there if Epi has anything to add. Thanks.
Just to add that 2024 data is still preliminary at best. We know that with the coroner death reports, it takes a long time for us to really see these kind of changes over time. So even with our kind of preliminary numbers, we can't really say with Ottawa with any certainty that we have in fact seen a decrease in 2024 compared to 2023. We're still getting in reports for all of our deaths. And I think that Ben did a really great job. It's so multifaceted. It's very difficult to say if there is truly a decrease, why that could be, and it could change dramatically in the next quarter of 2024 2024, 2025, and onwards with toxicity and a bunch of other factors. So.
Thank you for the clarification, and with the indulgence of the chair, I just have one further comment. Because you've asked us to write to the ministry for just more funding. There's a long list of initiatives in our strategy, and as been pointed out, they're all very important. They're all interconnected, and we can't neglect any one of them for the other. But I'm just wondering, in terms of, putting in a request to the ministry, we may wish to think about being a bit strategic in how we frame that request, in really thinking about which initiatives in our minds may be having the most impact, and be ready to scale across Ottawa or across. We've heard suggestions of the anchor program, moving from one neighborhood to the other, or the core program. So I would encourage staff to help us in that regard, to really think about an impactful recommendation to the ministry. And in the same way, how are we shaping the funding request to the ministry? It's a diverse funding streams. And as a government, someone who sits in a government office myself on a daily basis, receiving these, I mean, it really helps if the recipient can really frame sort of, are you thinking about like a sustainability fund that is cross-cutting across sectors, or are you recommending sort of a more siloed approach to specific interventions? So we just encourage us as OPH to think about how we craft that request or letter in a bit more strategic way. Thank you for your work.
Thank you, Member Bauer. Just before I go to the next speaker, given the number of hands up, very likely that we're going to go past 7 o'clock. So we're just going to need a motion.
Be it resolved that the Board of Health approve that the meeting time be extended past 7 p.m. pursuant to subsection 8(1)(c) of the procedural bylaw.
Is that carried? Thank you. Member King.
Thank you, Chair, and thank you. I want to really thank staff for this in-depth report and for the work that's being undertaken by multiple partners. I think that was demonstrated in the report. I share many of the concerns of my fellow members. We heard it also from Councillor Troster that given the evidence showing that consumption and treatment services prevented over 5,000 overdoses since 2021. I think there's general concern about the impact on the future of life-saving interventions. So I just wanted to ask, with the closure of the consumption and treatment service site at Somerset West, what specific impacts is staff monitoring, and what mitigation strategies are being implemented to fill the service gap? And I think that was a question that Councillor Troster had proffered.
Yeah, thank you for that question. We are working really closely with Ontario Health, with our provincial counterparts as well. We are working with our local providers. There is weekly and even daily updates that the providers are providing directly to the ministry. And then there's also Ontario Health that's collecting information and data. Ontario Health is connecting in with hospitals, emergency services, health providers in order to aggregate all of that information. And then Ottawa Public Health is also working with partners to add qualitative elements to that as well, to ensure that all of the information is being captured. It would be still too soon to try to summarize or sort of put all of that into wording in terms of what we're seeing, but we have heard a lot of it today. So we are seeing need that is represented in our community, and we are seeing folks who are looking for support, looking for services. And the big takeaway from us at Ottawa Public Health is, what are the things that we know that are going to make a difference through the work that we've seen and talked about today? And things like continuing to make sure that we have enough outreach, making sure that we have people outside connecting to people, working hard to connect those people to services, we know that safer spaces is such a crucial part of this. So where can we connect people to? Where can we continue to look for safe spaces for individuals during the day, during the evening? So the emergency treatment funding from Health Canada has really helped us do that, bolster up outreach, help paramedics buy more equipment and a physical truck that they can operate in Centertown like they have in Byward, where they're going to have a dedicated service. And then the Solicitor General funding that Sarah Taylor spoke about, that's going to also really be bolstered, so that how can we coordinate our outreach services to make sure that we're all working together. There's so many great partners doing great work, but how do we connect? How do we work together? And how do we make sure that we're providing those services in the places and the locations that we need it most? So far, that's what we're really seeing from the feedback we're getting, is we need to have people outside. We have to be continue to look for safer spaces. And we also have to make sure that when people are reaching out for help, help's there. And that's a continued piece of work. And to Member Gower's point, why we really need to be specific in our recommendations to the ministry when we write them, so we can try to articulate what could we do immediately that would help people right now.
I appreciate that answer. I know that you touched on outreach, and I know the report mentions the collaborative Urgent Connections outreach project. I'm wondering if you can comment on what specific metrics will determine its success and what sustainable funding options are being explored.
I'll take that as well. Thanks. Metrics for us are things, for example, something that is showcasing to us that Anchor, which Anchor is the alternative to police crisis response taking place in Centertown right now. And a similar metric that we would be looking at would be things like how many interactions led to a reduction of people going to the emergency room. How many interactions would lead to a reduction of emergency services having to be called. So the outreach providers, one of the goal is being able to provide immediate support in that exact moment, so that there wouldn't have to be an escalation and pulling on emergency services that are so vitally needed throughout our city. So those would be the types of things that that enhanced outreach would be looking to make an effort and make an impact in. And the other pieces, right, it's really ongoing right now. So Community Social Service Department has had 2 meetings of outreach providers, and part of those meetings and part of that work is doing exactly that, setting up the metrics. And I could share the ones about emergency services because I know those will be on it, and it's such a big part of our Anchor work. And then what would sustainable funding do? It would help in a significant way so that we can make sure, not just in a one-time way. So the Health Canada Fund, which we're very grateful for, and the Solicitor General funding, those are time-bound. And one of the concerns we have, and our partners always have, is when we're able to provide a service for a time-limited period, and then the funding goes away and that service is no longer there. And we know that that's a really difficult thing to do to a community, is build something up, provide a service that's meaningful, and then that service goes away. So sustainable funding would really help let the residents know, the businesses know that this is going to be here for the future and that we can count on it. And that's part of what we wanted to do with our report, is advocate for sustainable funding for these partners. And that funding wouldn't be for public health. We would be a part of the team, but it would be really for our health and social service partners.
And I appreciate that. I strongly support the recommendation for sustainable funding of innovative solutions that address the full spectrum of needs. I'm going to be very supportive of the letter to the provincial government, other partners, to ensure that we strengthen the funding into this program. Is absolutely necessary. My last question, Chair, just really focuses on housing. And given the housing substance use connection highlighted in the report, how is OPH specifically working with housing providers to integrate health supports?
Thank you for the question. We, something that we're collectively absolutely committed to at Ottawa Public Health, and it now forms one of our strategic priorities, is looking at the integration between health and housing. We recently, at the end of 2024, held a health and housing forum with CSSD, bringing together health leaders from across the region. And in the picture that was shown about our overdose strategy, that foundational piece to it, that nothing truly can advance and be done without housing. And so housing is such an integral part of our work in overdose prevention, in suicide prevention, in mental health promotion, community safety. And so we are working really closely with our housing partners. It was mentioned earlier, we contributed data to the Heart Hub applications, and we're currently sitting on the executive group of the Heart Hub networks, looking at all opportunities to make sure that the housing and health piece is integrated and together. For a long time, there were two separate discussions. And I think over the last year, we've seen through Ottawa Public Health's work, we're really trying to bring those things together. So in everything that we do, there'll be aspects of that where we're speaking with our housing partners. How do we build this work together? For years, Kira's team's been working with our housing partners on naloxone training. Our mental health team's been doing suicide prevention training. So this is going to be a large part of our work moving forward, is continuing that integration, and hopefully part of that sustainable funding could also support work so that we could have more housing supports where health is integrated into those housing supports.
I appreciate that answer. And I was just wondering, I noticed in the report, it talked about really working with all city departments and providing coordination there, but I didn't see Ottawa Community Housing there. So I was just wondering if you'd be willing to take direction to ensure that Ottawa Community Housing is around the table. And I just say that because of recent discussions that I had with senior leadership there about the need for greater coordination between certain programs that really help in the assistance of transition to OCH properties, that the people who are transitioning, that's great, but we're hearing from the community housing providers that they need additional supports to ensure successful tenancies. So I'm just wondering, number one, if you would take direction, and number two, whether there's any work that's being undertaken there. Go ahead.
Yes, it's a great question. We certainly are engaging with Ottawa Community Housing. Ben did a very good job of laying out all of the pieces where we're looking at the overlaps between health and housing, but actually that's another part of the strategic plan. And yeah, we've been engaged with Ottawa Community Housing on how we can provide public health services, potentially geographically located with them, or also just how we can support them around other services. And one of the proposals that we've discussed is Healthy at Home, and our board chair has done an excellent job of recognize the importance of housing as a fundamental determinant of health, and is advocating for this across the province. So yeah, we're very hopeful that that proposal, which involves Ottawa Community Housing, would be something that would be a good model for supporting people at home.
Excellent, thank you. So just for clarity, we would share that information, not unlike what we're doing with city departments with OCH in terms of moving forward.
Sure. Yep. We can take that direction to share the report and information with Ottawa Community Housing as well.
Excellent. Appreciate it, and appreciate the hard work of staff on this report. Thank you so much, Chair.
Thank you, Member King. Vice Chair DiGiuliani.
Thank you, Chair. Congratulations on this report, and I really enjoyed the conversation. I think Member Bauer's advice around the funding is solid, so thank you for that. And congratulations on securing that one-time funding. And it's one thing to have a proposal, but to have something that you can demonstrate the impact is a huge step forward, both for the community and for securing ongoing funding. So congratulations on that. I also appreciated the link to housing as well as being fundamental. And, what was really clear to me through the report was the emphasis on gathering data and the role that OPH plays. I think you really summed it well in the sense that there are many, many partners here, and OPH can't possibly provide all the health services that you're capable of, but that, everyone has a role to play. And I think one of the big roles for OPH is that system data piece that will be really crucial. I want to leave sort of how we deal with the current crisis for a moment and focus on the upstream. And I know that that's always a tension for public health is, the current and then looking upstream about how we can get ahead of this. What was shocking to me was the statistic around 20% of, grade 7 to 12-year-olds having access and using. And I just wondered about the link to school boards, knowing I'm certain that some of these youth also struggle to attend school, but knowing that they could be an anchor partner as well. And if you could just describe our linkages to the school boards there and what we can do maybe differently or what you've been thinking about in that regard.
Yeah, thank you for that. And thank you for the first part about the one-time funding. It was something that I do want to mention. Probably the biggest factor in receiving that was the data. We were told from Health Canada that having the data behind us and the dashboard really highlighted the need and allowed us to get there. So appreciate you mentioning that. As it relates to school boards and prevention, prevention is such a crucial pillar of the overdose strategy. Starting from the very beginning, we have incredible staff working in our healthy growth and development team, and a new program that they've been doing over the last year is a CBT program for new moms, and they're currently scoping expanding the program. And that program is something that showcases that we know that during the postpartum time can be a very challenging time for the well-being of moms and dads. And so making sure that we have supports in place to support those new parents is crucial. So starting from there, moving into our school programs, we're a proud partner of something called Project STEP, which is United Way, ourselves, addiction treatment providers, Rideau Wood and Le Cap, and the school boards working all together to do prevention initiatives in the schools. We have done this year, my team members listening are going to be upset if I don't get the numbers exact, but we've done 2 really large sessions at professional development days for teachers this year, working on stigma, how to talk about substance use with students. We did the presentations with the clinical service providers from Rideau Wood. And so really building confidence with the teachers on how do we talk about drugs? How do we talk about substances? How do we make it so it doesn't feel as challenging to connect a young person to support? And then Rideau Wood and Le Cap have the addiction counselors directly in the schools. And so this is something that the data is telling us we need to continue this work, and we need to make sure that teachers are feeling confident to ask the questions. The parents have the tools in their toolbox to have the questions as well. So on our Parenting in Ottawa site, we have a whole section on how to talk about substance use. And we recently worked with an incredible organization of people with lived and living experience called Families for Addiction Recovery. And we made a tool on how parents can have the conversation at home with substance use. So it's a big part of our prevention plan. And unfortunately, the data is telling us that we need to really continue and double down on this work as the trends that we're seeing in young people are really troubling. And why that might be is for someone else, but what matters to us is this is something we really got to focus on. And so prevention will continue to be a big pillar, and the school boards also, to mention, have a new legislated requirement to have their own wellness plans. And our boards are doing an incredible job at building that into the curriculum and into the work. So that'll be something that we continue to work with them moving forward. Thank you.
Nice, excellent, thank you, and thanks for also mentioning that CBT work. I had written that down and meant to thank you there. I know that it's far from my wheelhouse, but good evidence to support the early attachment for mental health wellness all around, not just addiction. So I'm really happy to see that supported. Thanks.
Thank you very much.
Thank you, Vice Chair. Member Chung.
Thank you, Chair. Thank you, staff, for such a comprehensive report. I did have 3 questions. And I guess my first one is about the inhalation. And forgive my ignorance, but what is the barrier to supporting people who use drugs via inhalation in the consumption treatment sites, especially given the increase in usage via inhalation and the increase in deaths? My second question was regarding the statistics that the majority of people who access the consumption treatment sites are men 30 to 39. Just wondering if that's aligned with the population characteristics in people who use drugs, and if not, if there are others demographics, if there's anything being done to address the access issues. And the third question I had was regarding the CBT program for new mothers. And I understand completely the connections to mental health and the risks there, but can you expand on some of the kind of the direct evidence linking, highlighting that in this report? And those are my three questions. Thank you.
Thank you so much. I'm gonna start backwards with question 3, and then I'll move to my colleagues for the other pieces. So there's data that showcases the correlation between individuals struggling with mental health concerns and substance use, and oftentimes one of the coping strategies that an individual will undertake while struggling with mental health challenges is using substances. We know from data as well that new parents are sleep deprived, dealing with so many challenges, and at that moment, being able to put more tools in the toolbox of new parents about coping strategies, working through the challenges through cognitive behavioral therapy, providing peers that are also going through similar things can be real protective factors for individuals at that time. So putting more protective factors into their toolbox and ensuring that the risk factors like using alcohol or using opioids, using cannabis to deal with the mental health stressors can unfortunately lead someone down the substance use spectrum into an area of challenging behavior and problematic behavior. And so we want to be able to intervene at that right time and support the parents in the best way we can. So that was the correlation there. And that the same could be said of others struggling with mental health challenges, but as it relates to new parents, the risk factors for mental health challenges and substance use are elevated during that time. So that to us is a great partnership as well. We're working with Ottawa health teams and hospitals on this program, and the nurses who are running these programs are already seeing pretty great feedback from new moms that these supports and having peers connected in this is making a difference. So that was the correlation. I will now pass it to Kira to speak about safer inhalation. Kira.
Thanks, Ben, and thanks, Member Chung, for that question. So with regards to the supervision of inhalation within our current supervised consumption and treatment services, the way the services are set up right now, it would require additional operational as well as capital funding to be able to set up the supports that would be needed to provide this. And the current provincial funding model for consumption and treatment services does not allow for safer inhalation services to be added to the current existing model of care. So what we are currently doing, and obviously in collaboration with partners, is focusing on providing safer inhalation equipment, increasing peer outreach and supports to make sure that people are aware of this increased risk of inhalation services, that they have access to peer support networks, peer overdose spotting, and other supports that would be needed to prevent and respond to overdoses in the event that one occurs.
Okay, great. Thank you.
I can respond to the
Sure.
middle question. Yeah, there's another one. So in terms of the people using CTS sites and the age group, I don't believe we have any data. Like the group of people using drugs is very hard to kind of nail down. So we don't have a demographic. We know everyone in all walks of life are using drugs, but we don't have any data in Ottawa about kind of age group demographics, breakdowns of things like that. We have breakdowns by, say, ED visits for drug overdose, but we know that's not representative of everyone using drugs. So it's difficult to say, you know, if we're reaching that target demographic with CTS sites and usage for those age groups. However, we do know that like 30 to 45 is kind of a key age demographic that we want to be targeting because they're at high risk of deaths and overdose in ED. So we're not sure a full kind of denominator to really say who's using CTS, but generally, hopefully we're reaching people that need the services, and we know that they're needing the services.
Great, thank you. Thank you, Member Chung. I'm not seeing any other questions, so I just wanted to take a moment to thank the team here for the report and for answering our questions tonight, not only those that are at the mic, but we know that there's other members of the team here with us tonight and certainly watching online. And, you know, I think Ben said it well when he said you're working on a very difficult issue at a very challenging time. So we really appreciate the work that you're doing in the community and also that of our partners. We heard from some of them tonight in the delegations. And I do want to thank the counselors and the residents that came out to speak tonight as well, to share their lived experience about the community impacts. It's very valid and an important part of this conversation as we navigate this crisis together. So just a big thanks to the team and to my board members. We do have some recommendations that I'll read out. That the Board of Health for the City of Ottawa Health Unit 1 receive for information an update on the collaborative efforts to advance Ottawa's overdose prevention and response strategy throughout 2024, as well as key priorities in 2025. And 2, request the Chair of the Board of Health to write a letter to the Ontario Minister of Health recommending that they A, continue to explore, expand, and sustainably fund innovative solutions to the toxic drug crisis and related health and social issues in acute care and community settings, including ensuring a well-funded, supported workforce in alignment with the initiatives outlined in this report. B, support health and social service sectors to effectively track and disseminate mental health, addictions, and substance use health data, as discussed in the Office of the Auditor General of Ontario Performance Audit, implementation and oversight of Ontario's opioid strategy. C, increase sustainable funding for First Nations, Inuit and Métis mental health teams, Inuit family health teams, and the Ottawa Aboriginal Coalition Indigenous mental well-being strategy to enhance mental health and substance use health supports and services for First Nations, Inuit, and Métis communities, including the development of the new Indigenous Family Healing Lodge, the Inuit Boss Shelter, and the Aging Out Initiative. And 3, direct the Medical Officer of Health to share this report and the accompanying documents with relevant city departments to inform their plans and strategies that either directly or indirectly impact the toxic drug crisis, including the Community Safety and Wellbeing Plan and the 10-year housing and homelessness strategy. Is that carried? Great. Thank you, everyone. Thank you. So we have just a few more items on the agenda. Information previously distributed, we noted that. We have no in-camera items. Motion to adopt reports. Member Gower.
Be it resolved that the Chair of the Board of Health verbal report, the Medical Officer of Health verbal report, and the reports titled Indigenous Rights, Health and Reconciliation, Update on Ottawa's Overdose Prevention and Response Strategy, 2024 Operating and Capital Year-End Results, Board of Health for the City of Ottawa Health Unit Status Report, Delegation of Authority, Contracts Awarded for the period of July 1st to December 31st, 2024, and attendance at the Association of Local Public Health Agencies 2025 Conference and AGM be received and adopted.
Is this carried? Great, thank you. We have no motions of which notice have been previously given. No motions requiring suspension of the rules. Do we have any notices of motion? Seeing none, confirmation bylaw.
Be it resolved that confirmation bylaw number 2025-3, a bylaw of the Board of Health for the City of Ottawa Health Unit to confirm the proceedings of the Ottawa Board of Health at its meeting of April 14th, 2025, be read and passed.
So carried. Wonderful. Do we have any inquiries? Seeing none, we are adjourned. Our next meeting is Monday, June 16th.